Asthma is a fairly common respiratory disorder that can have a severe impact on an individual's life, where the body can basically overreact to a perceived problem, creating a far greater problem. So what's going on inside the lungs to cause asthma, and how do the inhalers help to relieve the symptoms? Well, in our lungs there are alveoli, which are kind of cauliflower-shaped structures deep in our lungs where the gas exchange takes place, with carbon dioxide being expelled from the blood vessels and being replaced with a fresh supply of oxygen. The alveoli are connected by small tubes which join up to become larger, so they become the bronchial tubes leading out of our lungs. Now these tubes or airways have a ring of muscle about them, which provides some strength and rigidity to the structures, preventing them from collapsing when we breathe. Inside the layer of muscle is a lining, protecting the airway from damage. Coating that lining is mucus or sputum. This means, however, that if the muscles around the outside of the airway tighten, the tube narrows considerably. This in turn can restrict the amount of air that can actually pass down the pipe. Additionally, if the lining on the inside of the muscle wall becomes inflamed, again the airflow is restricted. However, the inflamed tissue may also release additional mucus in an attempt to cure the cause of the inflammation, and again that may reduce the airflow. If all of these three things happen at the same time, it becomes very difficult for someone to get enough oxygen into their body to keep them alive, and this is what's happening in an asthma attack. So if someone's exposed to an airborne irritant like smoke, pollen, or other fine dust particles, these can irritate the lining of the air tubes, causing them to become inflamed, produce the excess fluid to remove the source of the irritation. And then at the same time, muscles also tighten around the tubes. However, if the person involved has asthma, this reaction is extreme, and the passages become so tight that air whistles as it passes along the tubes, resulting in the wheezing of the person as they try to get enough air into their lungs. Which is why increases in pollution levels lead to an increase in the number of people having asthma attacks. Now, to prevent or mitigate an asthma attack, two types of inhalers can be used to introduce drugs deep into the lungs where the issues actually are. The first type of inhalers are known as preventers. These, as their name suggests, work to stop an asthma attack happening and operate to reduce the general inflammation of the tubes and also to reduce their sensitivity. So if some irritant does get into the lungs, they don't overreact to it. The second type of inhalers are known as relievers. These attempt to mitigate the severity of an asthma attack when it's actually occurring. The inhaler works to relax the muscles surrounding the airway, making it wider, allowing more air to pass through. So if someone you know is actually having an asthma attack, the reliever inhaler, which is normally blue, is the one they're going to need to help them.